One of the most talked about topics for infants and babies' health is tongue ties, and now more than ever, it's getting the blame for countless pediatric health conditions. And so many questions surround this topic. Hi, I'm Dr. Ken, and in this video, we'll break down the science behind your baby's tongue tie and not just the potential difficulties that can cause with breastfeeding, speech, and neurodevelopment. We'll go way deeper than most do and investigate why we're seeing so many of them in practice today and what the true root cause of all this trouble may be. This video is for parents, moms especially, who are wondering, one, if their baby has a tongue tie. It seems like every practitioner has a different opinion on the severity. And two, is this the reason they are struggling with latching, uncomfortable nursing, gaining weight, colic, reflux, and overall comfort? We'll talk about potential causes of tongue ties, and we will look into the connection between prenatal development, the birth process, and the prevalence of tongue ties. And most importantly, give you the best care options that address the cause of the tongue tie. First, I want to talk about what is a tongue tie and the symptoms that commonly follow. Tongue tie is a condition that affects newborns where the strip of tissue that anchors the tongue to the floor of the mouth is too short, restricting movement and function of the tongue. This can make it difficult for a baby to breastfeed effectively as they may be unable to properly latch and nurse. You may also commonly see this condition referred to as TOTS, tethered oral tissues, which includes discussion of the frenulum and other connective tissues of the mouth and jaw. Some babies with a tongue tie have difficulty opening their mouth wide enough to effectively latch and breastfeed, leading to difficulties such as attaching to the breast or staying attached for a full feed, being unsettled and seeming to be hungry all the time, not gaining weight as quickly as they should, and many times they will make a clicking sound during feeding or do a lot of clamping. Many of the signs and symptoms of a tongue tie mirror those of general colic and neurogastric distress in a child, so it's often difficult to delineate between the two and, most importantly, what the root cause is of your child's nursing and sleep challenges. Is it a tongue tie that's causing my baby to struggle, or is it something else? To answer this question fully, we have to dig into what is causing a baby's tongue ties. Traditional medical explanations often attribute tongue ties to genetics, but there's more to the story. Some natural health practitioners connect it to mutations in the MTHFR genes, affecting folate absorption. Studies even suggest that increased folic acid intake may play a role. As a pediatric chiropractor, we specialize in neurology and neurodevelopment. We go beyond traditional approaches, exploring factors like soft tissue and nutrients, and here's the key. The tone of the nervous system influences the tone of muscles and soft tissues. If the mom and baby's nervous system is stuck in a fight or flight mode, it can affect the frenulum, mouth, and jaw. While physiology and chemistry matter, true health and development always starts with the nervous system. The nervous system is key in perceiving the environment and coordinating cell behavior. Applying this to tongue ties, it becomes clear how various issues can arise. Ultimately, tongue ties, like many conditions, are often a combination of factors, a perfect storm. What is the connection between stress prenatally and at birth with TOTS? The perfect storm so often comes prenatally from an emotional fight or flight response of mom and in turn baby, and then is compounded by the birth process or delivery. When babies have physically stressful birth, it commonly includes two main components, misalignment and fixation of the vertebra that are biomechanical and musculoskeletal in nature. Combine this with in utero stress and a neurologic component arises during key developmental periods. In fact, there is a study that found 99 out of 100 healthy newborns did have an instance of somatic dysfunction, also known as misalignment and fixation stress, during the birth process. This causes an already stuck cranial and oral system that developed in utero to be further twisted and torqued, putting even more pressure on baby's neuro-oral movements. Many parents choose to have their child undergo a tongue tie revision surgery performed by a pediatric holistic dentist or an MD. This procedure is crucial for both short-term and long-term well-being, considering its effects on nutrition, neurologic development, and emotional bonding. However, just like any medical procedure, there are factors to consider when making this decision. If babies experience stress in utero, abnormal fetal positioning, and birth trauma, could the increased tension and thickness of the soft tissues be a protective response to the entire neurological system? Here's the catch. If the tongue tie is surgically revised without considering the underlying tension and without consulting a pediatric chiropractor first, things may initially worsen instead of improve after the surgery. In this scenario, the original cause and neuromuscular tone that contributed to the problems remains unaddressed. Additionally, the child has to cope with the pain and restrictions that often accompany the post-surgery recovery. It's a lot to handle for our little ones. So the key takeaway is this: before considering surgical revision, check the stress and tension in the baby's nervous system and help remove and unwind it along with the connective tissue revisions. By doing this, we can work together with surgical revisions, which can lead to the best short-term and long-term outcomes for your child. We know navigating tongue ties or potential tongue ties can be complicated and complex. We're here to help. And again, we find that baby's tongue tie comes with moderate to severe tension and stress in the nervous system. If you found this video helpful and have more questions, comment below or send us a DM. And secondly, please share with other parents, family, and Facebook groups who need this. Thanks for spending a few minutes with me, and we'll talk again soon.